Good afternoon. My name is Carmen Wabagijik-Nuchtai. I'm the Director of Health and Community Wellness for Tikmikshing and Anishinaabe. Welcome today to your health Q&A for this week. Today is July 23rd, and this week we will be talking about the reopening of the community plan that has been updated and accepted by Council on Monday, July 20th, and also an order that was updated and approved by Council on Monday night at their band meeting, and some other areas that fall into place with that. So I will begin by introducing our panel, and today we have Amanda Wabagijik-Jourdain, our Health Promotions Manager, and then we have Rachel Patterson, our our Health Programs Manager, and we have Bridget Prouse, Communications Officer in the background, assisting us with this recording. So I will begin, and just to let everybody know that we have extended the state of emergency by 1 month. So this is up until August 29th. It's important for people to recognize that it is not a simple on and off switch in terms of the state of emergency and pandemic response efforts. The state of emergency and our orders provide an opportunity to not only convey the significance and reality of the ongoing pandemic, but allow Council to pass emergency measures to either close or open the community through a phased approach. This allows us to properly monitor the impacts these measures have on the COVID-19 risk level. Yes, we may lack capacity to enforce, but these measures provide clear guidance to our membership and community members and visitors on the restrictions that are in place to keep everyone safe.
So the most recent order number 200104, covers the following. The extension of the state of emergency, as Carmen stated, it's been extended by 1 month. There will be reopening of gathering areas, which include the basketball court, the playground at the park, community center, reserve camp, and the chalet. There's also been an expansion of travel without mandatory self-isolation and mandatory testing. So given that any persons who has traveled outside the following areas will be required to obtain a test when they arrive home by calling the HSN Assessment Center. These areas include Windsor, Essex County, Peel, Toronto, downtown Toronto, York Region, Durham Region, and Ottawa. HSN COVID-19 Assessment Center is open between 9 a.m. and 5 p.m. 7 days a week. You can also call this number at 705-671-7373.
Any person who refuses to be tested will need to self-isolate for 14 days. Prevention measures when traveling to the above noted areas: must wear a mask when traveling except children under the age of 2, individuals with a medical condition that makes it difficult to wear a mask, individuals who are unable to put on or remove a mask without assistance, and people who require accommodation in accordance with the Ontario Human Rights Code.
I would also like to add at this point that we do have a COVID-19 response team, and they continually meet twice per week, and they provide direct oversight over these response efforts and to provide recommendations to GIMA and Council. I encourage all of us to think about how we can play a role in keeping our community safe and our families safe throughout this pandemic. GIMA and Council thanks you for your continued efforts in keeping Tikmikshing and Anishinaabe safe.
24th, 2020, and the community center will be open as of Monday, July 27th, 2020. This is for band members only at this time, and please be aware that the COVID-19 protocols are in place along with restrictions and tracking. Full details can be found on the COVID webpage.
Okay, so now I'm going to be talking about the retailer standard operating procedures that are in effect on July 20th, 2020. So the minimum requirements for standard operating procedures during the COVID-19 pandemic are as follows. So hand sanitizing stations at the entrance and exit, one-way traffic flow by placing signage on floor and walls, limiting the number of customers in store to maintain the 2 meter, 6 foot physical distancing, plexiglass barrier installed at point of sale. Tap payments are preferred, covering the point of sale keypad with clear wrap and disinfecting them often. Disinfecting commonly touched areas, including staff lounging area. Proper disposal of masks and gloves. Self-assessment sign to be posted at entrance of the store. Masks are only required when physical distancing cannot be maintained. If a customer is refusing to maintain a 2 meter distance, it is at the store's discretion to either require the patron to wear a mask or refuse service.
Okay, so that was really quick. I didn't think we would be that fast in talking about these. But if you do ever have any questions, you can always give us a call, and with any questions relating to COVID-19 testing and all of that, you can call Marina McCumber, our community health nurse, or myself. So now what I wanted to do is just introduce you to Rachel Patterson. Rachel just started with our health team on July 13th, and she's our health programs manager. So she is replacing Darlene Shabonquit, who was in that position for a bit, and then she ended up applying to the Director of Education Social Services and received that and was successful in that application process. So today we do have Rachel, and I just want to introduce you to her as our health programs manager. And I wanted Rachel just to talk about herself, where she's coming from, a little bit about her education and qualifications, and we look forward to working with Rachel in this as we embark on this new journey. Take it away, Rach.
Thank you. We got you, Carmen. First, I want to say I'm really happy to be back. I am my name is Rachel Patterson. My maiden name is Neponce, for some of you that don't know me. I was born and raised here in Atikomaksing, and I live here in Atikomaksing with my husband and 3 children. I have a grandson and a little nephew with me, so I have a very full household here in Atik. I'm really happy to be back. I've throughout my career as in social services, I've held many positions within the community, education, early years. I was the Nagani worker for a period of time, and I took some time, a little halt in my career to stay home with my kids and run a business. From there, I came back to work and worked for Nogda Windeman for 4.5 years. But my heart has always been with the community. So here I am, I'm back. I applied for the health programs manager position, and I was successful. So I'm really excited and happy to be back working in my home community again. And I look forward to seeing everybody around the health center once things start to see some sort of normalization.
Mm-hmm. Okay, miigwech, Rachel. And we're very happy to have you come back to the organization and play this role in the community, and the amount of knowledge and education and experience you have. I believe that you are gonna bring a new, how would you say, it's like a new ambiance to the whole health team. So miigwech for that, and thank you everybody for watching our health Q&A this week. It is short and sweet, and hope you enjoy. And again, if you ever have any questions, please give us a call. And for more information on the state of emergency extension and the orders, please go to our website at www.atikomaksing.ca, and you can go to the COVID-19 tab, and then you'll get all the information there. And enjoy the rest of your week. Miigwech. Bamapi.